Simple enough question. All are associated with the risk of development of surgical site infections, except even when I have taught you wounds. Now we know what are the factors which affect wound healing. The same kind of factors will kind of affect the risk of surgical site infections. So what will affect the risk? People who have obesity, of course, because obesity is associated with atherosclerosis, poor vascularity of the surgical site, so it will increase the risk of wounds getting infected. Uremia, yes. So this is something from Bailey. Any metabolic disease of a significant magnitude, like uncontrolled diabetes, we all know, but here I put the option of uremia. Okay, because everybody knows diabetes. Jaundice will all affect wound healing because your metabolism will be altered, your immune system will be altered. Obviously, immunosuppression will affect wound healing. Goes without saying, so steroids, chemotherapy, immunosuppressing diseases, right? Surgeries where there was a contaminated surgeries, like a GI surgery where there was a bowel which was perforated, or during cholecystectomy, if the gallbladder burst, surgery becomes contaminated, increase the risk of SSI. Poor tissue perfusion. So certain sites where the perfusion is poor are at a more risk. Presence of foreign body in the wound, especially for us surgeons, mesh. Whenever we do hernia repair, if you are putting a mesh, or for orthopedics, if you are putting an implant, TKR, THR implant, these are very critical areas where risk of wound infection is high, because if the bacteria gets contaminates the implant, it will remain there forever. And of course, poor surgical techniques of certain kinds, like, now this is a little broad specific, but what can they ask you in the question is what you should know. So devitalized tissue or necrotic tissue, obviously dead space. Now very important here, dead space. So dead space increases the risk, which is why if the wound has a lot of depth, we tend to obliterate it, and closure of dead space is a good thing. So the answer here is option D. Foreign body will increase the risk like implants, but dead space, if you don't close it, that will be the risk factor. So closure of dead space obviously will reduce the risk. Surgical site hematomas. So these are some of the things which are associated with wound infection.